Here's a CT that was performed on a patient with umbilical or periumbilical pain. And so the CT of the abdomen pelvis was performed with contrast. The predominant finding is going to be in the right lower quadrant. And if we focus in on here, here's our right colon. It's actually fluid filled, which can be consistent with the diarrheal state. But if we come down lower, here's our terminal ileum coming out right here. And then we come even lower than that. Here's the cecum. And we can see that there's some wall thickening involving the medial aspect of the cecum extending into what ends up becoming the appendix. And so there's this appendiceal mass involving the base of the cecum. If we follow the appendix out more distally, we can see that it really thins out and looks more normal appearing at the very distal most portions. And so that would not be consistent with appendicitis. When you have appendicitis, you usually have something blocking the base of the appendix, and then the distal parts become dilated and they dilate all the way out. In this particular portion here, we're not seeing dilation in the most distal portion of the appendix, so that wouldn't make sense for that. This ends up being an irregular soft tissue mass, and so this is a patient with appendiceal adenocarcinoma. Now the drainage pattern for the appendix is important, and here you can see along the drainage pathway of this, there's an abnormal appearing lymph node that looks quite irregular. If we follow the venous drainage back again even more, we can see an even larger appearing implant or lymph node here. And you want to follow that back up to eventually into the portal vein and into the liver and see if there's metastatic disease in there. And there's nothing on this CT scan that suggests that it's involving the liver, although in subsequent CT scans, this patient ended up having metastatic disease to the liver. So this is a case of appendiceal adenocarcinoma. The differential for this would also include appendicitis, but like we said, it's not dilated distally. There's no periappendiceal inflammatory stranding in the fat to suggest that. Another differential would include appendiceal lymphoma, which is rare. Another differential would also include a mucinous neoplasm, although this looks wall thickened and irregular in shape. Usually a mucinous neoplasm of the appendix will just look tubular and fluid filled and maybe have some REM calcification within it.